Hi, my name is Sarah Lark. I'm a nurse practitioner student. Tonight I will be doing a subjective head-to-toe assessment on my husband, Justin. All right, so what brings you in today?
For an annual physical.
All right, and can you tell me a little bit about your past medical history?
I had seizures when I was young. Started around at age 8, and I outgrew them at around age 15.
Okay. Have you had any surgeries?
No.
Okay. And your social history. Are you married?
Yes.
All right. Do you have any children?
No.
All right. Do you have any animals inside the house?
Yes, 2 dogs.
Okay. And are you employed?
Yes.
Full-time or part-time?
Full time.
Okay. And then do you live in a house or an apartment?
In the house.
Okay. And I'm going to ask you some questions. Do you drink alcohol?
Rarely.
All right. And how many per week would you say?
Maybe 1.
All right. And is that liquor or beer or
Liquor.
wine? Okay. And then are you a smoker?
No.
And do you do any recreational drugs?
No.
Okay. Next, we're going to move on to family history, and we'll start on your mom's side. And you can give me your mom's history, and then we'll go through your mom and dad.
Okay. My mom has had cancer. No other issues though. My grandma has had she has diabetes, and that's about it. And then my grandpa has had open heart surgery, and he's also had cancer.
Okay. And then moving on to your dad's side of the family, we'll go through your dad and then your dad's mom and dad.
My dad is healthy,
Okay.
and as far as his parents, there are some heart issues, but other than that, there's nothing else.
Okay. All right. And then are you taking any current medications?
No.
Any vitamins or herbal supplements?
No.
Okay. Any allergies?
Just seasonal.
Okay. And then on your immunizations, are you up to date?
Yes.
Okay. And when was your last tetanus shot?
3 years ago, I think.
Okay. And do you get a flu shot yearly?
Yes.
Okay. Next, I'm going to ask about your general health. Do you feel like you're in good health? Do you have any concerns? Any issues with fatigue or pain recently?
No, I feel like I'm in good health.
Okay. Have you had any weight changes?
No.
Okay. And then next I'm going to ask about neurological issues, which when Justin walked in, I noticed normal gait. But have you had any weakness, numbness, tingling, any recent trauma?
No.
Okay. All right. Next I'm going to go through your head, eyes, ears, nose, and throat. Do you have any history, or currently do you experience any like headaches, any abnormal growths, any concerns regarding your head?
Just headaches.
Okay. And how often do you say you have a headache?
Maybe 2 a month.
Okay. All right. Next, moving on to the eyes. Do you have any redness, itching, any discharge?
No.
All right. And do you see the eye doctor yearly?
Yes.
Okay. And then with your ears, do you have any hearing loss, any abnormal growth, any concerns regarding your ears?
No.
Okay. And what about nose? Do you have any discharge in the morning or at night, especially? No? Okay. And then your throat, do you have any concerns when swallowing, any sore throat, any pain?
No.
All right. Next, we're going to move on to your cardiac history. Do you have any issues concerning your heart, abnormal heart rate, palpitations?
No.
Okay. Any chest pain or shortness of breath? Okay. And then your lungs, do you have any shortness of breath, wheezing, any cough?
No.
Okay. Next, we're going to move on to your stomach. Have you had any daily or recently any nausea, vomiting, diarrhea, any concerns with appetite?
No.
Okay. And do you have a bowel movement daily?
Yes.
Okay. have any issues urinating? Do you get up frequently at night to urinate? Any burning, urgency?
No.
Okay. Next, we're going to move on to musculoskeletal. Do you have any joint pain in the shoulders?
No.
Any weakness recently? Okay. What about your back?
No, I've had a few back problems where it's hurt for maybe a week or so, but nothing serious.
Okay. And then your hips, knees, or ankles?
Nothing.
All right. And then we'll move on to your skin. Do you have any concerns regarding rashes, growth, like a mole, any warts?
I do have warts on my hand here that I've been trying to get rid of, but other than that.
All right. And have you tried anything?
I just tried freezing them.
Okay. And do you have any open wounds or abnormal bruising that you're concerned about? Okay. Next, we're going to move on to psychiatric. Have you had any history of mental illness, such as like depression, anxiety, bipolar?
No.
Okay. And I did forget to ask earlier, do you have a family history of any mental illness?
No, I don't.
Okay. Next, we're going to move on to hematologic. So I'm going to ask you if you've had any issues with uncontrolled bleeding, any abnormal bruising. No. All right, and that concludes the subjective head-to-toe assessment.